Greetings and welcome to the Other Pandemic, Systemic Racism and the Impact of the COVID-19 Crisis on Communities of Color on Long Island, a virtual town hall. I'm Mario Murillo, Professor and Vice Dean of the Lawrence Herbert School of Communication at Hofstra University. Thank you so much for joining us. It's great to have you along. We would much prefer to be physically together, but I guess this is the next thing. So thank you all for joining us. The initial idea for today's virtual town hall emerged in early April as the country was struggling through its first weeks of national lockdown, hospitalizations, and fatalities due to COVID-19 on a steady rise, and of course the job losses that were exploding into the millions, an economic freefall not seen since the Great Depression. Early on, news reports consistently referred to this crisis as an equal opportunity health threat, that the coronavirus spared nobody, from actor Tom Hanks to Prince Charles, Senator Rand Paul to Prime Minister Boris Johnson. But it didn't take too long for people to realize that this was not the case at all, that for a variety of factors, the COVID-19 pandemic was revealing clearly how underlying racial disparities in access to healthcare, housing, and economic opportunity determined one's chances of survival. Indeed, for Black and Brown communities, the crisis was long in the making and only became more visible under the harsh light of the pandemic. On Long Island, in the communities surrounding the Hofstra University campus and beyond, the situation is particularly acute. On April 27th, the Long Island Advocate published an urgent piece by one of our panelists today, Dr. Martine Hackett, where she wrote, quote, "The shocking rate of deaths due to COVID-19 for Black people in Nassau County requires immediate science-informed action and leadership. Nassau County has known for weeks where the hotspots are for COVID-19 infection, and their delay in making local testing available may have cost lives. This is public health negligence," unquote. The situation was just as dire for Latino immigrant communities on the island, regardless of their immigration status. On May 1st, the grassroots organization Make the Road New York put out a detailed study of the entire New York metropolitan area. It was called Excluded at the Epicenter. In the report, they detail precisely how their members were some of the most at risk physically and financially in the crisis. Reading from the report, it states, quote, "They're working in warehouses, delivering food and cleaning without safety protections, without sick time, and without job security. This is not only a threat for those working, but for their families and for public health," unquote. In pointing out how African Americans are bearing a disproportionate burden of COVID-19 in Nassau County, the organization Erase Racism put out a statement in April urging Nassau County officials to address two related challenges. It said, quote, "First, it must increase healthcare access and COVID-19 testing in Black communities. Second, it must combat the structural racism that fuels the disparities. Government policies and actions perpetuate structural racism, and it'll take government actions to address the disparities evident from COVID-19, unquote. We're lucky to be joined by the president of Erase Racism, Elaine Gross, in today's session. And now we find ourselves in the midst of a national popular uprising after the brutal police killing of George Floyd in Minneapolis last month. The mass street protests taking place in dozens of cities across the country reflect the profound frustrations, not only with the excessive use of force by police directed at people of color, but with the systemic structural racism African Americans have been subjected to in the US for generations. The pain and the anger this has caused for so many members of our community is especially sharp since it coincides with, as I said, the news of over 100,000 deaths as a result of the pandemic, 40+ million people out of work caused by the economic shutdown, all realities which have detrimentally impacted Black, Latino, and other marginalized communities. So this town hall emerged in the spirit of community engagement and action. We recognize that in Hofstra University's immediate vicinity, these same issues are impacting our neighbors on a daily basis. Our hope is that this will be the first of many conversations and forums like this as part of the Long Island Advocate's mission to engage with local residents on important issues of concern. So a couple of quick things. Today's forum is sponsored, of course, by the Lawrence Herbert School of Communication and our multimedia hyperlocal community news site, the Long Island Advocate, in collaboration with the Press Club of Long Island and the Hofstra Cultural Center. I want to give a special thanks to Atheline Collins, the Executive Director of the Cultural Center, and Carla Schuster, who is the Assistant Vice President of University Relations. Also, special thanks to Mark Lukashevitz, who's the Dean of the Lawrence Herbert School of Communication, who's backed all these initiatives, and all the members of the Herbert School's Diversity and Inclusion Committee. And of course, a profound feeling of gratitude to our two faculty journalist moderators today, who I'll introduce in a second, and of course the panelists, not only for taking out the time for today's session, but for their tireless work in the community and their commitment to the belief that, yes, indeed, another world is possible. We'll have the panelist presentations for 8 to 10 minutes or so. There'll be Q&A led by the moderators, and we'll also be taking your questions via the chat room. So let me just get right into it and introduce our two moderators, colleagues and friends of mine. I'm pleased to welcome Dr. Crystal Zook, a professor of journalism in the Lawrence Herbert School of Communication. She has nearly 30 years of experience as an author and award-winning journalist. She's a former contributing writer for the Washington Post and Essence magazine, and her work on race, women, culture, and social justice has been published by dozens of magazines, newspapers, and digital outlets, including the New York Times Sunday Magazine, the New York Times Book Review, and The Guardian. Her most recent work is a series of 7 commissioned articles about biracial and multiracial identity that was published on medium.com. She's the author of several books, including Black Women's Lives, Stories of Power and Pain. And I should say that many of her students, both undergraduate and graduate journalism students, have contributed articles to the Long Island Advocate. Our other moderators, another good friend, Scott Brinton, an adjunct assistant professor of journalism at the Herbert School and is the executive director of the Long Island-based Herald community newspapers. I'm sure many of you are familiar with those newspapers, one of the largest community newspaper chains in the Northeast. He was previously its senior editor for enterprise reporting and staff development. Professor Brinton is faculty advisor and executive editor of the Long Island Advocate. He also co-directs the High School Summer Journalism Institute and founded the Community Journalism Program, a partnership between his graduate students and students at Hempstead High School. Both programs are aimed at diversifying the workforce and attracting students of color from underserved communities to pursue careers in media and communication, which of course we desperately need. So I want to thank you both, and I'll throw it now to Dr. Crystal Zook. Thank you, Crystal.
Thank you, Mario. Thank you everyone for being here and participating in this important conversation. I'd like to just jump right in and introduce our speaker, Professor Martine Hackett. She is Director of Public Health Programs at Hofstra University and co-founder of Birth Justice Warriors, which advocates for eliminating Black maternal and infant mortality in Nassau County. Martine Hackett published earlier, I guess back in April, this very important piece that I'm going to share with you in the Long Island Advocate on the power of local data with COVID, and just really zeroing in on the importance of getting those numbers and getting information about what's going on in Nassau and Suffolk County. So thank you for joining us, Professor Hackett, and I'll turn it over to you.
Great. Thank you so much, Crystal, Mario, and Scott. I really look forward to being able to share with you just some thoughts to sort of set the table for the rest of these great panelists that you have here. So I'm going to share my screen here with my presentation, which I will sort of take us a little bit through the ways, that we've been hearing about these sort of twin pandemics, we can call them, between COVID-19 and the police violence, and recognizing how intertwined they are and they share a root cause. So one of the things that we know, as has been said, is that even though COVID-19 was presented as an equal opportunity virus, we know that it has disproportionately affected people of color across the United States, specifically with Black Americans having higher rates of infection. In addition, we know that when it comes to looking at these cases, where we are really plays an important role. We know that New York State is the epicenter of these outbreaks. And we also know that some zip codes are disproportionately affected throughout the state. In particular, we know that when it comes to where that our communities of color are the ones that have the higher infection rates and also higher death rates as well. Again, thinking about the idea of as testing started to increase and be more available, and as testing was available in local county clinics in both Nassau and Suffolk County, that indeed the infection rates continued to grow as more tests became available. This is a graph that looks at, that I put together that sort of looks at this idea of these mortality rates. I know that my co-panelists are also going to talk about the effect that COVID-19 had on the Latinx community in Long Island. And so I just want to make clear that I'm focusing on the impact on Black residents in Long Island. And so just looking at this in terms of age-adjusted fatality rates. So what age-adjusted fatality rate does for those of us who are, relatively new to public health is that it allows us to compare different size populations by an equal, by using different denominators. And what we see here is that across the state, there have been disproportionate number of deaths to Black residents. And that, in fact, when we're talking about Nassau and Suffolk County, we're talking about 2.5 times. Now, thinking about that and just sort of, again, sadly telling us things that we already do know, one of the things we have to also then ask is why? Why is it that we're seeing such higher and disproportionate rates among these populations? And so one of the things that we know is that early on in the pandemic, when when hospitals were increasingly overcrowded, when testing was very, sparse and hard to be able to distribute, there was a certain level of decision made in terms of who was allowed to be tested and who were treated in hospitals. One of the things that we know anecdotally is that, sadly that research has been able to document, is that there has been some bias. There was bias in terms of who was allowed to be able to be treated, how people were treated. In fact, the idea that those who were minority, Latino and African American were turned away often at the hospital to be able to get tested and for further treatment. And so this is added on to our disproportionate fatality rates. Again, thinking about the why, we have to think about these communities and we have to think about what else is going on here. And so certainly racial residential segregation is a key factor that we cannot dismiss in terms of when we look at maps of the communities that are disproportionately affected. We know that those are racially segregated communities, and the racial segregation is one of the root causes for those differences. And, when we think about that racial segregation, we also have to think about the living conditions within those neighborhoods, within those zip codes. And what we know is that the spread of COVID-19 was directly affected by how close people were to each other. This is an infectious disease that is airborne. And so people who are living in crowded housing conditions were absolutely going to be at higher risk for this disease. And then when we think about I talked earlier about 2 pandemics, we can think about this as 3 pandemics, right? The idea also too of the wave of unemployment that happened as a result of the shutdowns across the country. And we know that within New York State, that Black New Yorkers have been affected very strongly. One of the things that I want to suggest that I've seen, and I'm sure many of us have also seen as a result of the murder of George Floyd and Breonna Taylor and others who have then been the reason for protests across all 50 states and internationally, is the concepts of certainly police brutality, but also sort of the underlying systemic racism that goes back centuries as to the reasons why people of color are disproportionately affected by police brutality. And so one of the things that we have seen is these words being used very, commonly with everything from in news coverage to sports figures to companies and corporations who are very freely using these terms. And so I want to suggest that when we're thinking about this, the idea that racism, not race, is actually a risk factor for dying for COVID-19 is something that we see, as well as recognizing that we can put together coronavirus and racism as public health emergencies. And so one of the things that we do in public health is prevention. And when we try to prevent disease from spreading, we need to look at the root causes. And the American Public Health Association has considered or has designated racism as a public health problem, as well as police brutality. And so when we are seeing this, what we are seeing is it being brought into the discourse, this concept of the connection between structural racism at its root and the consequences that happen as a result. This is my last slide, and I just sort of set the table for the rest of the conversation to recognize that what we are seeing is a need for action and a need for serious changes in the systems that cause the systemic racism. We know that Boston, Denver, Indianapolis, and Dallas, just in the past couple of weeks, have declared racism a public health emergency. This is something that I would suggest was unlikely to have happened without these pandemics and without the protests, but it certainly presents a good starting point for us to be able to have these issues on the table and to be able to discuss them in a way where we can be productive in stopping the spread of these root causes.
Okay, thank you so much, Martine. That was incredible. I have the pleasure and honor of introducing Eliana Fernandez, who is a Patchogue resident. She lives near where I grew up in Yaphank out there. So Eliana, we're fellow Suffolk residents. She's an Ecuadorian immigrant, and she's the lead organizer for the nonprofit organization Make the Road, New York. She is among those suing to reverse President Donald Trump's rescinding of the Deferred Action for Childhood Arrivals, or DACA program, which shields from deportation children brought to the US by undocumented immigrants. She was among 200 people who marched 230 miles over 16 days to Washington, D.C., ahead of last year's hearing to raise awareness of the issue. So with that, I turn it over to Eliana for her presentation.
Good afternoon. Thank you so much. My name is Eliana Fernandez. I am a lead organizer with Make the Road New York, a nonprofit organization that serves low-income communities and communities of color. I help lead the one here in Brentwood. And I have been with the organization for about 5 years. And as it was mentioned, I'm a DACA recipient. So the work around immigration and serving the immigrant community is really close to my heart because it's like personal. It affects me and my family. And to dive into the conversation around COVID-19, there has been many things that we had to witness our communities suffer due to COVID-19. To me, it was just like mind-blowing to see how, as I mentioned before, this virus disproportionately affected community of colors and immigrant communities. Just to give you like an emphasis of how it affected Long Island and Brentwood, one of the towns where our office is located, had the highest rate of cases of COVID-19. And a lot of people had asked the question as to why. And I think a lot of us know the reason why. We have seen time after time the communities who don't get the resources that they need, communities that don't, I'm sorry, the noise, that they have to choose, right, between going out to work and staying home. It's not something that they have been able to do. A lot of the people who have gone sick from our community are the very essential workers that have been going out to work on a daily basis, either at the supermarkets to deliver food, to drive, to deliver other essential things for hospitals, cleaning hospitals. So those are our folks, right? The ones who are getting sick, the ones who don't have a chance to stay home because they have to choose between feeding their families and not feeding them. And as it was mentioned before by Professor Martine, I think that also the access to healthcare has been a big issue. And that has not been only around COVID-19, but that has been happening for many years. In terms of the undocumented community and the conversations that I have engaged with our folks, a lot of them have gone sick and didn't seek medical help because one, they didn't have health insurance. A lot of them were afraid of the public charge rule that if they were able to seek medical insurance, that will have immigration consequences. And also, I think language played a huge barrier, right? For the people who were getting sick and needed to go to the hospital, you weren't allowed to bring anyone with you when you went to the hospital. So for the folks that don't speak the language, having to come across that barrier is very difficult. Like, for example, I know both of my parents got sick with the virus, and I was the one calling the ambulance, calling the doctors, making appointments. And that was like me being very privileged of knowing the language and knowing how to express their needs. But a lot of our families don't have that. And so I think that played a huge role. And a lot of folks also don't get in the care that they need. We have done a lot of workshops to educate people about emergency Medicaid, which is available to undocumented folks, and it doesn't count towards the public role charge. And a lot of people in the community didn't know about that. And they were concerned, like, is this going to affect my immigration status? How is that gonna affect me down the road? So we were trying, to provide as much information as possible. The other big issue in terms of healthcare, testing at the beginning of the pandemic was not available. It was very, very difficult for people to get tested. The way I see it, it was, unless you were dying, you were getting tested. And they only listed like 3 symptoms for you to get tested, which was like shortness of breath, coughing, and fever. And so it was upsetting at the beginning because people who were sick just couldn't get tested because, they didn't show like all the symptoms, all the 3 symptoms. And I remember seeing a post from a friend of mine who had someone sick of COVID, who had called the ambulance quite a few times, and the ambulance refused to take them because they weren't sick enough. So that to me was upsetting. And I ended up following up with them, and the person was able to recover. But that to me is like, it's having a healthcare system that is not accessible to everyone. It's not fair for our community. So those were like some of the challenges. And then I think like the one that concerned me the most, and I know I discussed with Mario in the past, was for people who had family members that were sick at the hospital and that were intubated and had to make the decision to disconnect them. And when people call us asking like, how do I make this decision? Like, how do I go through the process of like disconnecting my my family member? Is this the right thing? So I'm not a social worker, I'm not a psychologist. So having to hear those concerns and seeing my community suffering, having to make that decision and not knowing how to deal with the process or the bureaucracies within the hospitals, it was like very difficult. So we reached out to our health department to guide them in terms of like what steps they needed to follow. And that creates a lot of anxiety too in the community. I mean, when we talk about this pandemic, we should also be talking about mental health, because that has affected people like greatly. Because just anxiety of not knowing what's going to happen, of having family members just sick at the hospital, not being able to see them, not being able to like hug them or like have that human contact, I think has affected a lot of people. And even for those that passed away, not being able to have a proper funeral has been devastating for our community. Only being able to have 2 or 3 people in a funeral and not being able to mourn with the family has affected them as well. And the second component, I guess, of this pandemic has also been people losing their jobs, people not having access to any income whatsoever. And when it comes to the immigrant or the undocumented community, our people have not received any sort of relief from no one. A lot of them that have mixed status family were not included in the CARES Act when it first happened. Just because they had a family member who had an IT number, they were excluded from any sort of help. our folks are not able to get unemployment insurance. They're not able to, a lot of them apply for food stamps because they don't have a status. So those are the same folks who are getting sick, who don't have access to healthcare, who don't have access to money, who don't have access to food. I know Long Island had a lot of different food pantries for people that needed them. But we also need to consider that a lot of our communities who are poor communities, sometimes they don't have access to a car. And getting to and from the pantries is also being a challenge. And I think the third issue will be like housing, right? We know how expensive housing is in Long Island. And as it was mentioned before, a lot of our folks share sometimes the housing with other people, like either an apartment or sometimes they just rent a room. And for the same people who have been like, able to not to pay rent, and they're worried about that. And this is why we at a state level are fighting for three things. One, we want the government to create a $3.5 billion emergency fund for those people who were excluded and are essential workers, to cancel rent and to free all the people who have been detained in jail and detention centers, because it's impossible to keep social distance in those spaces. And lastly, I just want to invite people to take a look at our report that, as Maria mentioned, came out a few weeks ago, excluded in the epicenter. And it's very detailed about like how this pandemic has affected communities of color, and how many people have been not able to access any resources. 84% of people are out of work. Only 5% have received unemployment benefits. And 1 out of 6 have also lost a family member. So if you have time, check the report out, and it's very detailed and inclusive. It's across New York, not only like Long Island, but all the places. And I hope that you take a look and see how this pandemic has disproportionately affected our immigrant community. Thank you.
Okay, thank you, Eliana. And I'll just go forward and introduce our next speaker. Elaine Gross is known as a leader in our community on Long Island on these issues. She's founder and president of Erase Racism, a regional civil rights organization that exposes the impact of historical and ongoing structural racism, particularly in housing and public education. Elaine, I'll turn it over to you.
Thank you. First of all, thank you for inviting me to this very important town hall this afternoon. And I just want to make a little announcement, because I have a guest and I fear that she logged in through the general link for the participants. And in order for her to be able to speak, you need to use the login that I emailed you earlier today. So make sure you do a copy and paste and you use that full link. It ends in some numbers that will help you figure out which one. So hopefully you can pop on. So I would like to first of all acknowledge that the folks in the public health community have been very helpful to me in thinking about structural racism. So we've thought of structural racism as the sort of historical and ongoing racial discrimination and segregation that impacts every aspect of life. And one of the things that the public health folks have always talked about are the social determinants of health equity. And so if I take that and also think about the social determinants of education equity, of economic equity, it becomes a little easier when talking to people for them to begin to grasp what I'm talking about. So I'm going to share my screen for a second here. Can you see that? So this is just a little graphic, and sometimes graphics can be worth a few hundred words. So as you see over here, we're talking about the housing discrimination that is so endemic to Long Island. We know that we were, the federal government was responsible for making sure that new housing, like the housing built in Levittown, that the white veterans took advantage of, to make sure that housing was not available to people who were not white. So Long Island started out with structural racism related to housing. And then having the racial covenants in the deeds meant that you couldn't resell. So that's just furthering the embedding of housing discrimination and segregation. So the housing discrimination causes residential segregation, and that means unequal educational opportunities, especially in a place like Long Island with 125 school districts that mostly mirror the residential segregation. Those unequal educational opportunities impact what the schools are able to provide for the students, and that influences the employment and career prospects. Because of that employment impacts income and access to housing in various communities. This is a simplistic circle, but I want you to think about that as we look at just one data point. We're looking at AP and IB courses, the availability of them. And during the 2018-2019 school year, white students were 3.4 times more likely to be enrolled in those courses for math and science courses than Black students in Suffolk County. In Nassau, it was 2.4 times more likely to be enrolled. Students attending the majority Black Hispanic schools have 37% fewer AP IB courses. So then the students attending the 70 to 90% white schools. So we're talking about, on average, 35 courses for the majority white schools, 21 for the majority Black Hispanic schools. If we think about what's driving that disparity, the first narratives that come to mind are things like, oh, well, the students, they don't want to take those courses, they don't work hard, et cetera. They're not smart enough to get in. All of those kinds of things come to mind. What people don't think about is the Newsday analysis that talked about $6,000 more per student in the wealthier districts than in the poorer districts. And even if you want to say money isn't everything, money helps a lot. And then when you think about the ongoing discrimination, so this is just not something that happened in the past, but if last year in 2019, if you saw the findings from the Newsday investigation, that three-year investigation, you saw that for the Black testers, 49% of those Black testers were denied housing in one way or another. They were steered to certain neighborhoods. They were told that certain housing was not available to them. We've had lawsuits related to rentals they were doing for sale. And for the Latinx community, it was 39%, for Asians, 19%. I say this because when we were talking about the COVID situation, can you see that? The Martine did a wonderful job of really giving a complete overview of the disparate impact on communities of color when you're talking about COVID-19. And so remember the little graphic I showed you about public school education? I'm going to just skip down here and show you this graphic in terms of what's driving the disparity. Again, that structural racism for Long Island, which is rooted in where you get to live, which impacts everything. It impacts where you go to school. It impacts your access to healthcare. It impacts what your environment is. That also impacts your health. So we're talking about this kind of inequity set up related to housing and education, and then the fact that you would have more individuals who are in those positions where they had to go to work. They are the sort of first line workers. And so they were exposed. So you get the greater exposure. And then with that greater exposure, the higher possibility that you're going to have the underlying health conditions that mean that you will be less likely to recover from the illness and more likely to die from the illness. So racism is absolutely part of the social determinants to health and to a lot of other things as well. So I would close by saying that I hope that in the midst of dealing with the very real immediate issues related to COVID-19, that we not forget that we must deal with the underlying issues of structural racism. Otherwise, we will just see a continuation of these issues. I remember with Superstorm Sandy, and we had people reaching out to us from a public housing development in Long Beach that had not received the kind of remediation that was necessary. Whatever the disaster is, whether it's a disaster brought on by a virus or by a hurricane or whatever, we will see time and time again the disparate impact. We will also see it with the things that are our ongoing aspects of life, whether it's the economy or education or anything else, when we so-called don't have a disaster. So we need to make sure that we look long-term in terms of trying to turn on its head structural racism and all of its manifestations here on Long Island. Thank you.
Okay, thank you so much, Elaine. You've certainly given us quite a bit of food for thought here. And I've got a bunch of questions that I'd love to ask you, and I'm sure everybody would as well. So we'll get to that in a few minutes, though. First, I'm here to introduce Nadia Marin-Molina. She is co-executive director of the National Day Labor Organizing Network, leading the Workers' Center and workers' rights areas of that work. Previously, she was the Workers' Rights Program Coordinator. She created and led the National Day Labor Organizing Network's Disaster Response Initiative to successfully train thousands of day laborers after Hurricane Sandy and build the capacity of the organization's member groups. She also spearheaded programs to protect the health of nail salon workers and to prosecute criminal construction contractors while at the New York Committee for Occupational Safety and Health. She received national coverage for her work as executive director at the Workplace Project, fighting hate groups and anti-immigrant legislation on Long Island. And she received her, her law degree from New York University School of Law and her bachelor's from Brandeis University. And so with that, I turn it over to Nadia Marin-Molina.
Hi, thank you very much. And thank you also for organizing this discussion. I wanted to mention a few different things. One is Endilan, our organization, and sort of the national level, very briefly, and then also mention two issues which are more focused on the local level, related to what Eliana was mentioning before. So Endilan is a national network. We have member organizations across the country who work originally specifically with day laborers. And many of the organizations created day labor organizing centers and placed workers in jobs in construction or landscaping or whatever the local needs are. Many organizations do that. Some of them do just more organizing with workers on the corners, and now with workers in many different industries. And we support our member organizations across the country with regard to workers' rights, worker health and safety, as was mentioned. And a lot of times day laborers can be, especially in a disaster situation of a flood, for example, are often responders, right? First responders like in Hurricane Sandy, which was mentioned, but also in, after Katrina and other disasters. So with regard to coronavirus, obviously it's a disaster, but it's different, right? It's not a physical disaster. And so we sort of thought about our emergency response and what are the things that we could do. And in discussion with our members, we focused at a national level on basically creating information, getting education out to our member organizations so that they could distribute to the workers, to the day laborers, because many times workers are isolated from sources of information and maybe use, for example, WhatsApp as a source for information instead of other social media or whatever. We saw that in our member organizations there have been day laborers getting sick, also staff and of the organizations themselves who've gotten sick with coronavirus, and so then that creates its own challenges for the organizations. So supporting with regard to that. And then also we created a national fund. So fundraising at a national level in order to be able to provide some funds to the local organizations that they could distribute as cash support, because we knew that day laborers were not going to be included, right? That whatever was created was not going to exclude day laborers and many immigrant workers based on the fact that this is usually true, right? And it did end up being true. So those are sort of the areas that we created as response. And I think here specifically on Long Island, I wanted to mention a couple of things. One is with regard to the exclusion of workers from the economic response, as Eliana mentioned. And then the other one is a specific situation of Freeport Village. And I'll talk about both of them. So with regard to the first one, I mean, it's, when there is an economic disaster, the economic response has to go hand in hand with the public health response, right? It's crucial, right? Because people are losing their jobs, and also just from a very practical point of view, in order to allow people to isolate, right? And to follow the public health directives, if you have the economic support, it supports the public health goals, right? And the two key areas in which the government has provided support to people have been unemployment insurance, right? And there was the expansion of unemployment insurance to be pandemic unemployment assistance, right? So it's expanded unemployment, and the federal stimulus. Those are sort of the two key financial responses, and undocumented workers were excluded from both of those. The federal stimulus, however, is just a one-time thing, and unemployment insurance is at least as important because it's an ongoing payment, an ongoing support, and it can be extended. And in previous economic recessions, it has been. So I think what I would add is just to that is to mention that one thing which came up in our discussions is the lack of understanding of how workers are not only need this fund, and it's not only important to support them, but also have been contributing, right? So workers, documented and undocumented workers have contributed more than $1.4 billion per year to state and local funds, and then more directly to unemployment, and so are absolutely unable to access those funds. And that the federal stimulus, the exclusion is particularly invidious because it doesn't just exclude people who are undocumented. They went out of their way to ensure that people, even if they had been paying taxes at a federal level through an ITIN number, people who were paying those taxes were explicitly excluded. And then on top of that, the families of people who were paying taxes. So if you're a citizen, you're married to somebody who's undocumented and was paying taxes through an ITIN number, you're also excluded from the stimulus. And so that it is clear that is a specific targeting and done very intentionally, right? And I think what I would also say, though, is that that's no surprise, right? Like from this administration and from this federal government, right? It's not a surprise that it's anti-immigrant and that they're going out of their way in order to be anti-immigrant. And I think the real question is, what are we doing at a state level, right? What is New York State doing? What is New Jersey doing? What is Connecticut doing? What are the localities doing in order to support their community members? And I think that they have to be challenged in that way, because it's very easy for them to just say, well, it's Donald Trump didn't do it. I mean, we know that that's true, but it's really important for them to take on their responsibility. So we're part of the same coalition that Eliana mentioned, that Make the Road is, and there are 84 member organizations that are participating. So it's a broad coalition. It's a good effort to create the $3.5 billion fund. I would also mention that the Long Island legislators, none of the senators have signed on. None of our Long Island senators have signed on to it. I think the Assembly people, Phil Ramos, attended one of the town hall forums, so at least he was interested and supportive in that way. But Long Island is not sort of showing up here in support. And then with regard to the fund, the other thing that I would mention is that if it was created, right now we sort of focus because it's our members on undocumented workers, but actually there are other workers who probably could be covered because it's created in such a way, or it would be created in such a way, that it's workers who are unemployed but are unable to access unemployment insurance. So for example, somebody who was incarcerated, who got out recently, has not had a chance to accumulate a historial of work in order to be able to access unemployment, also can't get it, right? So there's other ways that I think that it could be broader. It can be focused in a broader way. Freeport. With regard to Freeport, what I wanted to mention is the following. I think it's a good example, actually, of how a local government can and does use the pandemic as an excuse, perhaps, to do some of the things that they have been wanting to do for a while. So in Freeport, there was a day labor center called the Freeport Trailer, located near the Long Island Railroad, near a place where workers had gathered for years and years. It's been there for almost 20 years. Workers would find jobs there, connect with contractors. They would also have trainings, ESL classes, coffee, breakfast. There were homeless workers who were nearby. They would, have it as a charging station or a place to come in from the cold, etc. And when the pandemic arrived, they had been social distancing. They were just doing food distribution, and the workers were outside, etc. And they suddenly received notice that they were being evicted from that trailer, even though evictions were supposedly shut down. Within a couple of days, not even, they didn't bother going through a court process. They came in, locked the trailer, shut it, and removed it from the premises. So it's now hidden away in a lot in Freeport. And okay, that was one immediate action. The excuse that they've given recently is that they said that the trailer was not allowing for social distancing, which is just not true. Later, within a week or a couple of weeks, the village went in to demolish the tents, encampments, where there were workers who are homeless who are living in kind of near the train station, but in the woods. And so they went in, they'd given them a piece of paper. It said English and Spanish. It said you have 72 hours notice to leave. They went in and bulldozed the location. And the workers who were there obviously had to find somewhere else to go. And again, the reason that they gave was the mayor gave, and he spoke on the phone. He said that it was because of the pandemic, because it was dangerous for them to be out there, when the CDC actually recommends that homeless encampments not be disturbed, because obviously a homeless person doesn't have anywhere else to go. So in our point of view is that he had wanted to find a way to get rid of both the trailer and the homeless encampments, and that the pandemic was a good excuse for him to be able to use in order to do it. Currently, we are working with the workers. We're doing food distribution near the Unitarian Church, and the workers are beginning to organize to pressure for a new day labor center. That's kind of the focus right now of the workers, but I think it's a good case study, let's say, to show how local government can step up and do something good, or they can take advantage and really push through an agenda that's taking advantage of the situation to target some of the most vulnerable workers in their communities. So yeah, thank you. I think that those are just the key issues that I wanted to bring up for Long Island. And again, I really appreciate you bringing us together.
Thank you, Nadia. And I also wanted to introduce now Shirley Coverdale, who's joining us. And she's president and CEO of the Family Community Life Center in Riverhead. And she's going to be talking about some of her personal experiences with COVID-19. Thank you, Shirley.
Thank you, Crystal. I'm thankful to Elaine Gross, let me first say, for reaching out to me and giving me the opportunity to join this discussion as her guest today. And I have listened intently to all of the panelists, and I thank the people at Hofstra for putting on and airing such an important conversation. And again, Elaine did ask me to share my personal story. I think it's quite instructive and speaks more to the issue of implicit bias than it does to the systemic underpinnings of racism and their effects on the public health profile. So let me just give you a little bit of background, because I think I'm something of an anomaly here. For one thing, as far as housing being an antecedent, my family and I are fortunate enough to live in a zip code in the outskirts of Riverhead that is fairly affluent. My husband and my family members are all educated, having advanced degrees. Both my husband and I have MBAs from Harvard. My son is a graduate of Columbia Law School. My husband is the pastor of a well-known church on the East End, the First Baptist Church of Riverhead. And some 32 years ago, the church initiated a non-sectarian 501c3, which I run, called the Family Community Life Center. There are other stories that I could tell you wherein we have certainly suffered the impacts of bias and racism just in trying to develop a community center and affordable housing for our workforce on land that we own for the last 25 plus years in Riverhead, but that's another story. So to the COVID issue, we were directly impacted, my whole family. My husband had the virus, I had the virus, my son had the virus, his fiance had the virus, my grandson had the virus. So I can certainly say that underscores Martine's talk about higher rates of infection, because that's really a small group, but we all got it despite our trying to social distance. And we think that we came in contact probably in the church with someone who was infected. So we are thankful that we've defied the statistics about the higher rates of mortality. However, we're right in there when it comes to talking about who got tested, who got admitted, and I have to add how they were treated once they were admitted. So my husband was the first to show symptoms and create the need for us to call 911. He was taken to the local hospital only to be not admitted and sent back home, despite the fact that he was really very seriously ill. And about 2 to 3 days later, when he could not get up from the couch and slid onto the floor because he couldn't walk, they had to actually come back. And at that point, they admitted him. The doctors, as was said in the other comments, we could not go with him. All we could do was be in contact by phone with the doctors. And someone called me in the wee hours of the morning after he was admitted and told me emphatically that, especially if any of the others of us were symptomatic, we should get tested. So a couple days went by, and my son and I went to the hospital on instructions of the doctor to get tested. Told them that at that point we both were running low-grade fevers. I had some coughing, the symptoms that they tell you about. And first of all, the person that waited on us at that point was going to send us to an urgent care or somewhere else if we wanted to be tested, and stated that I hadn't told her we were symptomatic when that was the first thing out of my mouth. So once we persisted, they took us into the ER, put us both in the same room, and indicated that they were not going to test us. We should simply assume that because my husband had been admitted that we were positive and just go home and quarantine. So we were left somewhat frustrated because we couldn't get tested, and within several days, I could not breathe. I was coughing severely. I had nosebleeds, I had fever, and we had to call 911 again. They almost didn't take me because they said, my blood oxygen was too high. They weren't going to take me. But they did take me to the ER after we kind of insisted. And at that point, they sent someone in who tested me and said I was positive for pneumonia and acute bronchitis. And they then tested me for COVID and sent me home. So I got worse and worse until the doctors that I was communicating with about my husband's illness were saying, I don't understand why you're at home. You can't even talk. You sound horrible. You can't breathe. And I kept wondering how this was happening when they said, if you're short of breath, go to a hospital. I could not eventually even communicate words. And my family had to tell people who were calling to stop calling me because I could not communicate with them. I had at least 4 doctors ask me if I was crazy not to be in the hospital, and I had to explain to them that we kept calling 911 and they would not take me to the hospital. In fact, the last time we called 911, they triaged me on my front porch and told me they could take me to the hospital, but they were just going to turn around and send me home. So at that point, I really was wondering how many people they had sent home to die, because if my son had not been here to take care of me and he was coughing up blood himself, I would have died. I'm sure I would not have made it, because I reminded myself that I was like someone on a bad movie that was gasping for breath because they were in a room that was being sucked of oxygen, and so they had to breathe very shallowly, trying to conserve their breath. That's how I was breathing. It took me 5 rounds of antibiotics that my heart doctor prescribed for me, because I called him when my blood pressures were dangerously low, like 70 over 40 something. And he had to take me off of all of my blood pressure medication and order antibiotics for me. But it took 5 courses of antibiotics administered by 2 different physicians, my primary physician and my heart doctor, for me to get rid of the pneumonia, which lasted from the beginning of April through almost the end of May. And once my husband came home after 40 days of hospitalization, and he was sick enough that he was, I guess, 2 inches away from being put on a ventilator. He was consuming 16 liters of oxygen. And in order for him to be discharged with any oxygen that he would use at home, he would have had to be on no more than 2 liters. So he really was quite ill. And again, another issue of implicit bias, I feel. He was, I guess, getting fatigued of being isolated and disoriented, and he said that he was not sleeping, and he asked someone for a sleeping pill, and they sent a psychiatrist to talk to him about that, who told him no, he just needed to regulate his sleeping habits. He would just have to get over it, despite the fact that he was complaining about being awake from midnight till 9 or 10 the next morning. And meanwhile, you understand, we can only speak to him through the phone when we could get through. And this doctor, when my husband said to him, well, doctor, I think I would make much better progress at home where I have familiar surroundings, and here, the only thing here is the television. I'm a person like you. I'm educated. I have thousands of books in the library that I could consult. I need more stimulation than this, and someone around me who's gonna, not keep me in the dark and what have you. Well, the doctor went out based on that conversation and indicated that he had dementia, and put him on the dementia ward. And we had to actually intervene and talk to a doctor who knew him outside of the hospital, knew very well that he didn't have dementia, and to get that diagnosis taken off of his medical record. And when he tells the story now, he says he believes it was because that doctor did not expect a Black man. He did not know my husband, did not know of his background, did not know that he was a former college professor, that he pastored a church or anything else. All he knew is he's a Black man who said that he had 3,000 books at home. He must be crazy. So, again, we can talk about all of the systemic antecedents and contributing factors, but I think that if we're going to have a real in-depth conversation, we need to really understand that the systematic entrenched racism also leads to widely accepted behaviors of implicit, sometimes explicit bias that impacts us as Black people and brown people, that have disparate impacts because of it. So I think these conversations are wonderful. I think that without them, without unpeeling this onion, we'll never get to the bottom of it, and we'll never be able to heal. So I think we have to, not just write this off as something distant. I think it really is a call to action to each of us to examine ourselves and our own feelings when we're looking at someone. Are we otherizing them and applying a different standard than we would to somebody who happens to look like us?
I think we're going to open it up to questions at this point. I'm going to ask Carla Schuster if she can help us with some of the questions that are coming in. Meanwhile, I wanted to just jump in first. I know, Scott, you probably also have a lot of questions. When we talk about structural racism and all of the connections between housing and employment and education, I'm interested to hear from any of the panelists really on how COVID is bringing some of these connections to light. We've done some of that, but I think we could talk a little bit more about education and housing and employment. You know, we've talked about workers who have to get to work, who typically are Black and brown people, who are then more susceptible to the virus. But I'd like to hear if other people have thoughts about this interconnectedness.
I'd like to just say, first of all, thank you so much, Shirley, for coming. I do appreciate it. And I asked you to join us because racism trumps money. And so it was what they saw in you and your husband, that these are Black people. And that is why they had the assumptions that they have and everything else. And they got that from our structural racism, from the fact that our society is built on racism. And it's like we live in the soup. There's no way to get out from under it. And sometimes people think that, well, the money will get me out from under it. It's only to some degree. You know, there are those of us who have been able to break through in certain ways, but under certain circumstances, we're just Black people. And then the whole narrative about who Black people are and how their lives don't matter is what comes to the fore. And so, in fact, Crystal, your question about the interrelationship of all of these things, that's what makes it so confounding, is that it is all interrelated. You can't really talk about any aspect without talking about all of them having an impact. So it is the compounding effect of both our history and then what the things are that keep happening to perpetuate structural racism.
Okay, thank you. One of the questions we're getting is, and also I wanted to thank you, Shirley. I think that was a much needed interjection of reality. You know, we're talking about numbers and data and statistics, and that's all important, but this is impacting real lives. One of the questions is, have Nassau County officials responded to the lack of testing sites in the communities? If anyone can take that one.
Yeah, I'll take that. So yes, they eventually did respond in that they were opened at some of the federally qualified health centers. So in Freeport, in Hempstead, in Westbury, they did open up those sites to be walk-in sites. Those of you who live in Nassau County might remember that previous to that, the main testing sites were at Jones Beach. And so that certainly was a barrier for people being able to get access to those sites. But I will add that Nassau County did open up those sites 2.5 weeks after Suffolk County did, and beyond the, at the peak of the outbreak.
Crystal, you want to go, or?
why don't you jump in? I know you have other questions as well.
Yeah, I mean, I specifically had a question for Martine. So I think that Shirley's story, I mean, firstly, thank goodness, thank God your family's, I assume everybody is all good now, Shirley? So thank goodness. But you know, your work is based largely around implicit bias, or you've done a lot, I should say, you've done a lot of work on implicit bias, which she was speaking about, and gave this very concrete example. Can you talk about how implicit bias specifically, can you offer some examples of how that's you know, that manifests in sort of the everyday medical field? When anybody, a person of color, goes to the doctor, how does that manifest itself?
Yeah, so implicit bias is something, just to be clear, that everybody, you know, is, you know, part of, you know, all of us, as Elaine mentioned, we're sort of in it. And so we are absorb the larger narratives around Black people, for example, people who are immigrants. And so, you know, even that part of it is that it is unconscious. But in the healthcare sector specifically, there have been studies that looked at pain management, for example, that say that Black people, when they are expressing levels of pain, are not given appropriate medication to be able to alleviate that pain. Even children, Black children, compared to white children, are not given appropriate pain management. Certainly in the area of childbirth and labor, we know that Black women are often not listened to when it comes to issues around their desires for the types of births that they want to have, or their interest in interventions or lack of interest in interventions, and how the providers respond to them. And so the point is that we are bringing with us those preconceived notions that we don't even realize are preconceived, as we are even in a setting, where a healthcare setting, which is obviously meant to be objective.
And I had a question for Elaine. I know your work, you're looking at school districts, and it strikes me as profound that, you know, the difference between, say, one school district where it's predominantly a community of color, as opposed to a white school district where it might be $5,000 per student, the difference. But if you really think about that, that adds up to, say, in a class of 20, that adds up to $1 million. So, you know, what do we do about that? And two, what are your thoughts on having more regional school districts or countywide school districts where resources could be more evenly distributed? Is that an answer?
Well, when we started Erase Racism in 2001, not too many years after that, I don't remember exactly at this point, one of the things that we did was look at what would town-wide school districts look like? You know, just taking the population and then putting, you know, making the district line a town. And in each of those school districts, we had a really nice distribution racially. We had, and also in terms of students on free and reduced school lunch, we had a really nice distribution. I think those maps are still up on our website. And so, yes, we would have a very different landscape if we had, even by town, even if we didn't go all the way to county wide school districts, which a lot of places in the country do have. I think that there is, and this is where structural racism comes in again. One of the things that people say, oh, well, you know, you can learn just as well. It doesn't matter who's sitting next to you in the room. The issue is that with structural racism, it makes it so easy to hoard resources and opportunities. And so what happens in some of the school districts is, even with the caps, by the time they have their private foundations, you know, which the parents, you know, contribute to, the cap is not impacting the services and the opportunities that they have available for their students, because they have a workaround. And so it's always these kinds of things, you know, that in the ideal world, if we didn't have structural racism, then would it matter? maybe not. But as long as we have structural racism, it matters that we can't have the full equity in our public schools because of that segregation. And it doesn't matter how many times people say, oh no, it's not really about race and all of that. It is about race. And so it is very, it's difficult. It's conceptually difficult for people to see something that's not immediately visible. And so that's what we're dealing with.
Yeah, I'm wondering if any of the other panelists have any thoughts on that. And I do realize I made a mistake in my math there. So it'd be $100,000 per class, which is still a huge amount of money. But do any of the other panelists have any thoughts on that particular question? I turn it over to you, Crystal.
Okay, I think it's an important question from the chat about protests. We can't ignore the fact that there is a need to protest, and someone is asking, how do you balance this need with public health concerns, and what precautions do you recommend when it comes to protesting? I guess that would be a question for Martina as well.
Sure, I can start. And I can just say that from a public health perspective, there's almost, interestingly, I think that there are two sides to this. One is that on a, practical level, that if you are going to be in close proximity, chanting, yelling, this kind of thing, to wear a mask. If you're outside and participating in protests, and certainly that, again, wearing a mask helps to prevent the spread to others. And I would say the other side of that is, as we have been talking about, recognizing that structural racism is at a root cause of these health inequities, that in fact, protesting against it and getting laws changed actually is fundamentally a public health issue and a public health solution. And so, again, it might seem kind of counterintuitive to get people in big groups and having them, protest. How is that, keeping people socially distant and preventing the spread of COVID-19? The truth is that it is, because it's fundamentally getting at that root cause of being able to dismantle structural racism.
Mm-hmm. Scott, did you have another one, or should we
well,
from the queue?
Yeah, I'm interested to know from Nadia if there's follow-up on the Freeport situation. I personally covered that story. I've been covering the day labor camps in the woods for going back about 20 years. I've been covering the Freeport trailer for about 10 years. At the Herald, we recently covered that story. But what do we do about that? And do you have any information on the day laborers themselves? Because yes, CDC said this is not the way you're supposed to be treating it. And so do you have any word on what's happened to these men who are really homeless at this point? And I think an important note there is a shopping center planned for that area there, that site there, and maybe you could talk about that if you have any knowledge about that.
Yeah, well, specific to the workers and the people who were displaced, they are still there. I mean, not there, but they sort of moved. They scattered a bit, but they're still homeless and they're still in the same area. It's not like, when the mayor did this, people were suddenly going to be able to find housing. According to the mayor, they give the information, they gave them alternatives, right? Which means that they gave them the number for Nassau County Social Services, which, as we all know, is equivalent to not giving them any options. And I think with regard to that center, to that space in particular, it's interesting because apparently it's been a site of litigation between the village and New York State. It's been a disputed place for a long time. And so recently the village won that the right to develop on that land. And so they can sell it, or they can, have it developed now. And I understand that is the idea. And that in some ways explains the urgency, the fact that they won, I think in February, they won that case. Then that explains something of the urgency for both moving the trailer and the encampment, which was very close to that space. And I think, to go back to sort of the theme of this, I think there's an economic reason there, right? Like the desire to make money, right? In terms of the development, but the way that the eviction was carried out and the way that the workers were treated, I think it goes beyond that, right? I don't think that if they hadn't been homeless, if they hadn't been Latino workers, if they hadn't sort of been a group that the mayor, doesn't care about, right? Doesn't take into account when he thinks about taking care of his constituents, then they would not have been treated in that way. I think that's fairly clear. And in terms of next steps, like I said, the push right now, the workers have created a petition letter. That's just the first step to try to create a new center or new space.
If you don't mind, I just want to step in quickly. We're running out of time quickly. We have about 7 more minutes to go. We still want to take some more questions. But just a couple of things to wrap up. I want to point out that we hope to continue this dialogue, this conversation with all the participants here, with Erase Racism, with the work. I mean, when Martina and I were talking about this about a month and a half about doing this, we talked about the need to continue these conversations. This is just a start. And so we welcome that opportunity. But one area that we haven't touched, I mean, it has been referred to, another component of the crisis is the hunger crisis that the region is facing right now. And I haven't been to Long Island in the last few months, unfortunately, because of the lockdown. But right here in my neighborhood, literally outside my window in Jackson Heights, in the kind of the center of the pandemic here in Queens, you see at least 7 or 8 different community centers and organizers, Make the Road and other groups, handing out food, mostly to undocumented workers who normally would be working. They'd be at the front lines working, but they're right now literally starving. The meal that they get at one of these lines is like the only thing they'll be eating all day, because what little money they do have, they'll provide for their kids. And I want to talk about how that's impacting specifically on Long Island, because I've talked to a lot of people that in Freeport and Uniondale and Hempstead and a lot of places that this situation is just as acute. And I'm wondering if you could kind of shed light on that, and in terms of immediate needs, how that can be addressed. I'm not sure if somebody can touch on that. Eliana, I know that you've been dealing with that as well, and out in Brentwood as well.
Yeah, to respond really quick to that, I think, the county throughout the different food pantries that they have been able to, come up with days to distribute food. Although, like, for example, we're not allowed to share those on social media just because the number of people in need of food is so extended and like so big that if they publicize that, there might not be enough for everyone. But like this past weekend, for example, in Suffolk County, they had like a huge distribution of food at the Bayshore Mall. And I think the same thing has been happening in Nassau County. I know the Office of Hispanic Affairs has been sending us information about like food distribution. But I still think like, a lot of people still like, have not been able to access that in a way that, that helps, feed the entire family. And I know some centers during the whole pandemic were had to shut down just because the risks. But I think like the need is still like very, very huge. I know, for example, Make the Road, we wanted to distribute food in the Brentwood office as we do at the other centers for Make the Road, but we weren't able to get any food from any of the food pantries just because they said the number of people that they are serving across the island were so high that they weren't able to, allocate us with some food to start distributing. I mean, we had like, the volunteers and people like ready to go to start distributing the food, but there were no places to get the food from. So I think that this is still a huge crisis for our communities, and more people are like, relying on whatever they can get at the local food pantries to support their families, which is like really sad. I know we were able to provide some of our members with gift cards, but that's not nearly enough to, what they need to support their families. Some of them, I know I was asked yesterday to help find baby formula, not the regular formula, but this baby had like some issues. And I was like reaching out to my friends that run food pantries. I was like, oh my God, can you help me find these baby formula? Because not a lot of the food pantries give those out. So I think the need is still there. And I don't know how it will go down the path. But I think we're still could do a lot more for those communities who are going hungry.
Mario, can I just add that, if you guys are familiar with Jose Andres and the World Central Kitchen, again, this is sort of how Long Island is not really perceived as having these kinds of issues. They were reached out to come to Roosevelt and Freeport. And at first they're like, Long Island, like, what do you guys, why are you calling me? Why are you bothering me about this? And they had to be convinced, and they did open up a food distribution site a couple of weeks ago in Freeport. So again, that just sort of tells you the height and the level of the significance of this issue.
If I could just jump in here with one observation, going back to the Freeport, for the Freeport trailer, it struck me in speaking to a lot of the day laborers there, why they live in the woods, because a lot of them said that they basically wanted to have no expenses so they could send the majority of their money back home to people who would otherwise be starving back home in Central America, usually. So that was just an observation. Maybe Nadia, maybe you could talk a little bit about that.
Sure. I mean, I think that when you talk to workers, I think that can be a consideration, right? How much money can I save to be able to support my family is an important consideration. I mean, considering how cold it gets in the winter, I think it is a real sacrifice if that's a choice. And considering the expense of housing on Long Island, I actually think that the low income of workers, the lack of a steady income of workers, is probably more of the reason why workers are homeless. Obviously, if they can save some money to send to their families, they will, and they do. But I think that if they had the ability to spend a winter indoors and save some money to send to their family, I think that would certainly be preferable for them.
We're about at the end of our time. I just wanted to thank everyone for participating and giving us so much food for thought. And I would encourage everyone to visit the Long Island Advocate site, which is on Medium, and we're going to continue to have stories like the ones that are posted, like these stories, and to continue to report on these kinds of issues as they impact Long Islanders. So thank you, everyone. I don't know if Scott, Mario, you have any concluding words you want to add?
Well, again, thanks to everybody. And again, this is not the end of the conversation. We hope to continue these discussions and hopefully soon physically as opposed to virtually. But we want to thank Elaine Gross and Eliana Fernandez, of course, Nadia Marin, Martine Hackett, always. Of course, Shirley, thank you so much for joining us in the last minute. I would agree, your thoughts and your experiences, I think, really gave us a lot to think about in real terms. And then Scott and Crystal, I look forward to continue this collaboration as we look at these issues that, unfortunately, are not going away anytime soon. But that's why the struggle continues. So thank you all, and all of you viewing and listening. Hopefully, you'll continue visiting the Long Island Advocate. It's also going to air, the audio track of this will also air on our community licensed radio station, WRHU, Radio Hofstra University. So thank you very much.